Hi, my name is Kaylee Pierce, and these are my team members, Elise Lemansky and Kaden Boots, and we're presenting the reason behind patient no-shows. Our problem statement is an increase of revenue has been lost at student health clinics due to patient no-shows. And our focus question is how can we decrease patient no-show rates in student health clinics? Our method was our search through our databases from UK libraries using the Academic Search Complete and the EBSCO source. We try to use search terms related from the patient's perspective and patient no-shows, the reason behind it, and the factors of their absences. We try to limit the use from the provider's perspective and patients that reschedule their appointments to just use patients that didn't show up for their appointments. And our search strategy consisted of finding studies that focused on the reason behind these patient no-shows from the patient's perspective. So we got it from their point of view on how they wanted to better fix the problem and the solutions that they wanted to use. And as a result, we found that a majority of the patients that were surveyed through surveys handed out, online questionnaires, and telephone interviews that they preferred a call, a text, or an email as a reminder because the number one problem was that they just forgot about their appointment. And we tried to include data on the patient no-shows, the outcome measures, and we try to exclude the population of the area and the age group so we could get a better point of view from patients both nationally and inside a certain clinic setting.
So selecting the best evidence, we decided to answer our question by using peer-reviewed articles provided through the UK library database. Going through the articles in the database, we were able to identify those that had meaningful information that correlated back to the problem of patient no-shows and why patients did not attend their appointments. We were also able to compare results with each article and consider what had fit our criteria, such as the inclusions and exclusions. The first source that really stuck out was by Wong et al. In 2021. This study design was a qualitative perspective, which contained two phases, which the first began in June to September 2017, and the second phase conducted was in January 2019. The setting was in a dietetic clinic in Sultan Ismail. And in the first phase, they focused on patient no-shows and conducting surveys via telephone by calling those that did not show up to their appointments. And they found out that majority of them had forgotten about their appointments as they had no reminder. So in the second phase, they implemented an SMS system where they sent reminders via text message to the patients, and they found a decrease by over 50% when it had dropped from 40% no-show to 20% no-show from 2017 to 2019. Our second source was a study with a mix of qualitative and quantitative research because it measured the overall concern as why patients are not showing up to their appointments and their exact percentages as to the specific reasons why. And this setting was in a primary care facility, which relates more to our student health clinics. One limitation we found in both articles was that only a small sample size was presented when conducting phone call surveys because patients that did not show up to their appointments didn't conduct the survey after they're called by the study group. And the second study, actually, only 218 of the 675 patients actually responded to the questions.
So as we can see, that patient no-shows have become a big problem in healthcare facilities all over the country, and especially in our student health clinic as well. So the biggest takeaway as to why patients are missing their appointments, as we've said, is them forgetting about their appointments, which was a common theme that was portrayed throughout all of the articles that we researched. And due to their lack of remembering, this is why that is one of the major reasons that they are missing appointments. So this suggests that healthcare facilities really need to implement a reminding or alert system to to alarm patients of upcoming appointments. Some recommendations that we have provided is one recommendation for solving the issue is setting up a text message, email, or calling system to remind patients of their upcoming appointments. Because I know as myself, I definitely forget and am very forgetful. So having a reminder of when something's coming up is really helpful to me to remember it. And another recommendation for this problem is to send patients surveys and questionnaires on how they prefer to be reminded of their appointment if they want one, or just how could a clinic improve their communication to their patients. And this solution will be implemented by creating a text message, email, or telephone call system into our clinic, and it will be implemented immediately. As a clinic, we will go through patients' phone numbers and emails in order to send them a text message, phone call, and email to remind them of their upcoming appointment. Once they arrive to their scheduled appointment, if they come, we will find out their preference on what kind of alert they want. Some people may prefer phone calls or text messages or emails. So it's definitely up to the patient's preference. And some stakeholders of this solution is the organization's administration, so our clinic's administration team, the receptionists that work at the office, and the patients, because they're all involved in implementing this process and bringing about this change. And some potential barriers that could happen with this change being implemented is patients still not showing up to their appointments, or patients not wanting to receive a reminder, which is something that could be very detrimental to our clinic, or just communication issues due to technology. In the age of technology that we live in, there's a lot of issues that happen. So that could definitely be a big barrier that we come across. So that is our presentation of why patient no-shows have become a major problem and what we want to do to solve that problem.